Radiation is one of those hazards in the cath lab that is often underestimated, undervalued, and part of it is because we don't see an immediate effect. Although we know radiation can and will impact the operator, the effects may take years or decades to occur. So as a result, many people are very relaxed about it and they don't consider it being a problem. There are several papers regarding the radiation risks for patients and operators. A study that we did with our former fellows, Ari Karatasaki and Barbara Danick, it was done at 3 SKY meetings in which we had examination of the eyes of several interventional cardiologists. And what we found is that the more exposure they had over time to radiation, they were more likely to have opacities on their lenses. I also know of several colleagues who have had lymphoma or other malignancies. Of course, it's impossible to tell for sure whether it was radiation exposure or not, but many of them were highly experienced operators. They have been in the lab for a long period of time, and they have been doing complex procedures with long fluoroscopy times and radiation doses. In my mind, one of the biggest challenges and barriers to actually reducing radiation dose has been this disconnect between appreciating how bad it actually is and being willing to do something about it. I was able to use the ControlRad system last year going in Germany at the Siemens headquarters. And it is fairly easy to use. We used the tablet and selected the area of interest, which was then had high quality X-ray, whereas the other parts of the screen still were visible, but much low resolution, much less radiation dose. Right now, we collimate quite a bit, so to minimize the radiation dose. But collimation has the potential risks that wires and other equipment outside the field of view may be forgotten, and sometimes the wires can cause perforation or the guides may come out of the aortic ostium. If we had continuous visualization of the entire heart, the entire equipment throughout the procedure, having just the highest resolution X-ray at the area we're actually working at, that gives the best of both worlds, which is good visualization when we need it, but still visualization with low radiation dose on the other part. Having access to a system like ControlRad that minimizes disruption to day-to-day operations and provides a good radiation reduction for both the patient and the operator, that will be very welcome.